Good morning, good afternoon, and good evening to the participants and registrants and attendees attending to the webinar, AIBD webinar on health journalism, a dialogue with broadcaster. I welcome you all. My name is Lisa, and I'm going to be your project manager for this webinar. I would like to invite you, an all-round broadcaster. She's a radio person who's worked with TV and who has over 30 years of experience, who's the director of AIBD, Ms. Philomena Nyanapragasham, to give her opening remarks. Ms. Philo.
Thank you. Thank you, everybody. Apologies again, right? So I'm really happy to see all of you here today because we are discussing on something which is of great essence, and I think something which is so relevant in the world today. And we're talking about health, because health is the greatest of human blessings. And I think the father of medicine, Hippocrates, said that very accurately. And even today, as we talk about living in a new norm, living in a pandemic period where we don't even know whether we are safe, I think health takes precedence before every other thing in the world. And being a media person, I think a lot of focus has always been given to political news, to economic crisis, and even crime stories take more precedence on internet, on whatever social media platforms, and mostly also in our traditional mediums. And therefore, this is a historical meeting or a webinar that we are having today, and we're joined by many, many countries. And this morning I was on the radio, on Malaysian radio, Trax FM, talking about all the panelists who are going to be with us, and why we are doing this as a global initiative, because this is not just an initiative for Asia Pacific. I think health is a global issue, and therefore it's so important that we really look at media organizations who have joined us today, that they take a very serious stand and begin the process of initiating journalists to become trained journalists in health and science programs. And also in the newsroom, I think this is so important. You have a crime desk, you have a desk for political news where you place the journalists in the White House, or in Malaysia, it's Putrajaya, or anywhere else. But you don't have trained journalists on health and science, because this is so vital. And during the COVID pandemic, I think we have a very big issue of what do reporters report about? How do you actually get the experts when everyone is under a lockdown? So you don't have a database, you don't have a ready flow of what to do or what not to do, no proper work process or SOPs. So this is what AIBD is very, very serious about. We really want to make sure that everybody out there is trained, and we are ready to do this training with our experts today who are also with us in the panel. I really want to say thank you to all the experts. Suhaimi Sulaiman is a very well-known figure, and of course, Dr. Haq and Dr. Jia, and Mr. Madhu, who has been the main initiator of this, and also Khairunisa from the Malaysian Institute of Health. I think they're doing a wonderful job of bringing information about COVID. So I think this is an amazing group of people whom we have with us today. And I'm hoping that we will then be able to transform the minds of Asia Pacific to really look into health journalism. And we have Malaysia's business news channel head chairman here. So hopefully he will create a change in Malaysia, right? So let's look forward to this. And I thank you all once again. And we shall commence with our webinar. Thank you all.
Thank you, Philo. Thank you. And mass media today is filled with news, information, and opinion on COVID-19. There's a lot of disinformation and fake news as well. The front pages of all major newspapers, headlines of television and radio channels are also full of COVID-19 related news. Social media is no exception. In fact, most of the information that many of us get today on COVID-19 is through such sources. Even the light-hearted stuff, if you agree, and jokes circulated on social media are also replete with COVID-19 based situations. Countries that have a large number of cases sometimes highlight news about those countries who are worse off than them in controlling COVID-19. Some who have a very few cases, they boast about their health infrastructure and the measures they have adopted for control. But we have to bear in mind that cases have resurfaced in those parts of the world which had witnessed zero cases for a short period of time, be it in New Zealand or South Korea or China. The media has been highlighting efforts by local authorities in controlling the pandemic. But side by side, there are also a number of rumors floating around, especially over social media. I'm sure all of you will agree. Some forwards blame the country of origin for the spread of the virus. Some blame the World Health Organization for not acting fast. Some blame the local authorities for not taking adequate control measures. Some circulate extremely disturbing images of personnel and equipment shortages, food queues, mob violence, migrant woes, and deaths. Some forwards also provide information to the public on vaccines and cures. In most of these cases, there is often no authentic source quoted, and many such pieces of information are downright fakes. While it is a challenge to manage disinformation over social media, it is also noted that in all this mess, consumers of mass media, that is the ordinary citizens who are most affected, are at risk of thoroughly getting confused. This pandemic has also made the world sit up and rethink seriously about systems and procedures currently in place worldwide for control, treatment, and cure of diseases and management of a pandemic like COVID-19. It has highlighted deficiencies in our healthcare systems and protocols. The official figures as of yesterday of the World Health Organization say that over 9,129,000 confirmed cases of COVID-19 has been reported worldwide, which has resulted in 473,000 deaths. The pandemic has affected around 216 countries. In India, we had nearly 17,000 cases yesterday. What has this pandemic done other than putting a mask on every face, social distancing, and worry on every face? In our lifetime, there hasn't been a pandemic of this nature. So when will this, we have so many questions. When will this world return to normal? Will I be able to touch my friend again? Will I be able to watch a movie at the cinema hall? Will life be the same again? Ever? More serious questions are, how will I survive with my loved one who I lost to COVID? Will I get my job back? Can I rebuild my life? Will my business look up? And will I survive? Can the authorities cope? These are some questions for which people around are seeking answers, and answers quickly. That brings us to the state of health reporting itself around the world. How do we ensure ethical and accurate health reporting? It need not be about COVID-19, it could be Ebola, diabetes, or cancer. For today's dialogue on health journalism, AIBD has managed to get together a distinguished panel from around the world. We have Mr. Suhaimi Sulaiman, Chairman of the Malaysian National News Agency, Bernama. Welcome, Mr. Sulaiman. You have a great role in channeling the news flow in Malaysia. He will be talking to us about health news coverage, challenges during COVID-19, etc. And we have Dr. Zahid Haq, Chairman, World Health Innovation Summit and Senior Advisor, World Sports Alliance, Malaysia, who will enlighten us on media reporting on public health law. We have Ms. Khairul Unnisa Abdul Qadir, Health Education Officer with National Health Institute Malaysia, who will inform us about public health education and awareness. We have Dr. Xiao Fang, President of China International Health and Medical Tourism Association, who will tell us about world health tourism industry, trends, economic recovery, and innovation. Then we have former AIBD trainer and science writer, Mr. KP Madhu, who will deal with knowledge, skills, and attitudes necessary for health journalism and communication. That is our core area for discussion today. And we have Dr. Emma Rule from United Nations University, International Institute for Global Health, explaining to us the importance of getting accurate and updated health reporting to influence behavior, health policies, and decision making. Welcome, Dr. Emma. We have quite a few participants from several countries for this AIBD webinar on health journalism. We will go to all the panelists first, one by one, and then take questions towards the end. Please key in your questions for the panel in the chat box. We'll try and get you answers from the distinguished panel towards the second half of the webinar. So then, there you go. We have the Super Six waiting to give us a better insight into health journalism. So let's go straight to Mr. Suhaimi Sulaiman, Chairman of Bernama, the Malaysian National News Agency, for his take on health news coverage and the challenges during COVID-19. Over to you, Mr. Suleiman.
Thank you very, very much, Mr. Shivakumar. Okay, let me, the host has disabled screen sharing. Okay, then I think, Lisa, if you can share my PowerPoint presentation, yeah? Okay, yes, because I can't share it from here because I've been disabled. Oh, now I can share.
No. Yeah.
Thank you. I can share now. Okay, before I start, I have to say, happy birthday to Philo. Happy birthday, Philo. Okay, now, what I'm going to share with you today is basically what we all are facing in Malaysia at the moment. Yeah, it's basically health news coverage, the challenges during COVID-19. Now, one thing I must say that we as journalists in Malaysia, we are very, very lucky indeed, because there is a certain amount of predictability when it comes to information in Malaysia. For example, when we first announced our movement control order in the middle of March, yeah, that's when we started at 2 p.m. At 2 o'clock in the afternoon, everyone will know that they can switch on their television, yeah, they can switch on their radio, because at 2 p.m. in Malaysia, the senior minister and also the defense minister of Malaysia, Dr. Sri Ismail Sabri Yaakob, will be talking about security, about safety, and also SOP when it comes to COVID-19. That's at 2 p.m. So we know at 2 p.m. there will be an announcement every day. And at 5 p.m., the Director General of Health, Dr. Nur Hisham Abdullah, will provide the latest data. Yeah, how many people are infected, how many people have been cured, how many people, what cluster. So the details basically, and how to understand data. And also, in addition to the two predictable times, yeah, at 2 and 5 in Malaysia, you have this information. There will also be other announcements from time to time by the Prime Minister and also other leaders too. So here, the journalists will have all that information on daily basis to update the people. However, there are also challenges in getting other stories other than the official state announcements. For example, I have a couple of them, I think about 5 or 6 that I want to share today. Number one, what is the challenge here? When COVID-19 first appeared, many people are clueless about what COVID-19 is, and we journalists, we operate, we need to be fast, we need to be accurate, and at the same time, we must be responsible for whatever that we're reporting. So if only at that time, when COVID-19 first appeared, there is a panel of international experts helping us out, it would have been great. Yeah, but at that time, no, we have to scramble to get all our information. If only there is a dashboard, if only at that time a body or an organization would come up with a list of experts who are contactable 24/7, because this is not a problem that is unique to 1 or 2 countries. This is something that we face worldwide. So we need experts at the for the different time zones. The reason being, to reduce the risks of unverified data. Yeah, we also need to reduce the risks of wrong interpretations. Even if we have data, yeah, if we talk to different experts, could be the experts were telling us differently. There are different things. So if only there was a group of people then, when COVID first started, it would have been easier for the journalists. That's the challenge number one that we all face. Yeah. Challenge number 2 will be, when we interview scientists or experts, yeah, okay, I believe that whatever that we do, not just scientists or experts, even businessmen, engineers and all that, they must evolve and become great storytellers. You know why? Because, for example, yeah, because when you interview a scientist, normally the scientists will tend to speak and explain things as if they're talking to their peers. Yeah, so they have to be trained also to become great storytellers, to address information to the different segments of the population. For example, yeah, now they have done research. I don't know how far it's true. They say that now that our attention span is shorter than the goldfish. Okay, that's one segment of the population, and there's also another segment of the population that would want detailed information. So therefore, experts must evolve to become great storytellers. What's the solution? Yes, we journalists will help make complex ideas simple. But if it is the source that's able to make complex ideas simple, it would be good for the people who consume the information at the very end. Now, there will be times also where journalists need to simplify information in the form of infographics, because we realize today that I don't know. I started journalism in journalism 30 years ago. At that time, people love to read long reports. But today, if you give long reports, people will not read them. They want to see pictures. They want to see videos. They want to see colors. So it is important for a journalist to also translate long reports into diagrams, into infographics. Now, storytellers, so I think experts too must learn how to come up with great infographics. So scientists, doctors, engineers, experts must evolve to become great storytellers. So at the end of the day, people will be well informed. So that's the challenge that we face, because when we interview them, we got lots and lots and lots of things like this, medical jargons. You know, today we are quite familiar with R naught, flattening the curve, and others. But when it first started, it was quite a challenge to actually explain to the public what is R naught, what is flattening the curve. Yeah. Now, things like this. So we journalists, we just have to learn. You know, journalists, most of us are general. We come from the general desk, yeah. And then later on, we become specialists. We become political specialists, economic specialists, and I would agree with Philo. Not many are health journalists. Yeah, not many. They are, but today, realizing from COVID-19, I think we need more and more health journalists. Now, if we have more and more journalists, therefore, it would have been easier for us to explain what R naught is, what's flattening the curve, and all that. So for us, journalists, we just have to improve on our knowledge. We have to read, and read. So that's another challenge. Oops. Another challenge would be, how do we relate the topics to other things? For example, if we talk to people, yeah, when we report COVID-19, it's not just about the science, it's not just about the virus, it's not just about which clusters are affected. There are also other things, yeah? Other things, for example, you know, it's also related to business, it's also related to operations, it's also related to national security. Therefore, it is good if we can have experts being proactive to look at this. So I think that's why we need dashboard. For example, yeah, yes, we understand what social distancing is. We understand you need to wear masks and all that. But how do you explain to someone who runs a restaurant or somebody who runs a factory on what social distancing should be for their operations? Yeah. So we also need experts to actually talk about that. Yeah. So basically, everyone is learning. This is a learning process for everyone. So for journalists covering, yeah. So if only there is a body that get everyone together, yeah, to actually explain all this, it would have been easier for journalists all around the world, because it is not just about the virus, it's not just about the health issues, but it is also about how do you arrange your office now in the new norm. You know, you must have a certain distance with the person next door. So if you don't have space, how do you accommodate all that? So those are the things that we also need to have experts to talk about it for journalists. Okay, I'm not going to use the word fake news because someone commented earlier. So we say misinformation, yeah? Okay, things which are not true. There are lots and lots of information, not true information, false information being shared on the social media. Again, in Malaysia, journalists are very, very lucky, because the Malaysian Communications and Multimedia Commission, they're actually assisting us, not just the journalists, but also the Malaysian public, because they have a site called sebenarnya.my. So sebenarnya.my would track what is viral on the social media, you know, what people are sharing, which information that's not true. So then sebenarnya.my will say that, hey, this particular information that's viral at the moment is not true. Do not believe this. So when you go to that particular site, you can actually see, oh, this is not true, this is not true. So it's actually fact checking. And we in the media also carry that to inform people that do not, you know, you have to be clever in getting all this information from the social media. Some are not true. So you have to actually be clever and find. This is a great site where you can actually go to make sure that you get, you can verify, yeah, whether certain things are true or certain things are not true. Now, another challenge that we all face as journalists is basically the physical movement, yeah? Especially when you're a field journalist. when you talk about social distancing, you know, and many media companies, many media organizations in Malaysia, we have divided the groups into some 2 groups, some 3, for example. Some would remain in the newsroom. There will be another group stationed at another location. There will be also another group stationed at home, simply because we need to make sure that for business continuity plan, we make sure that should someone be infected, they will be confined to a certain place, so we can treat them so that it will not affect the other team members. So, and they are not allowed to actually see one another. We are not allowed to see one another until all this have settled down. Now, with that safety approach, yeah, with physical, with companies divided into 2 or 3 different groups, it makes life, it makes reporting quite difficult. Yeah, but we manage somehow, but it will take a longer period. I give an example. If we are used to doing a report in the newsroom, for example, here, I am as a reporter, I'll key in my, my stories, and then the graphic artist will be perhaps 3 meters away from me. I can just shout to him or her and say, I want these graphics, I want this color, this arrangement and all that. Now, just imagine if you are on the field covering stories, so you're actually typing the story on your laptop outside, and the graphic artist is working from home or maybe in a separate location, it will be quite difficult for you to actually interact and get the final product that you want. Yeah. So that is basically another challenge in reporting, especially now under COVID. But I think we have become smarter. You know, we have telepathy now. We basically know, oh, I know what you're thinking. Yeah. So somehow, you know, we tend to make the best out of situations. So that is a challenge. But what we have observed, it might slow down the process of disseminating news. But we still have to do it simply because that's how we should operate given this situation. So one way for us to do to manage that is by video conferencing. So that's one way to make our jobs even easier. Now, people are just human. Okay, we need to make sure that the morale is high, especially those frontliners, our reporters on the field. We need to make sure that they are safe. Yeah, they need counseling on a daily basis. You need to advise them. Yeah, and sometimes, you know, people can go crazy if you don't talk to one another, if you don't advise, because, you know, sometimes when you look at your camera, then you'll ask yourself, is my camera affected? You know, infected? Is this microphone safe? So that is why we need to constantly talk to them, counsel them on a daily basis so that the morale is high, and they will continue to work with and making sure that they are safe. So those are also challenges for us, yeah, to make sure that they're out there getting the stories and their mind is ready to go, but at the same time, they're aware that they have to be safe. Okay, another challenge is basically connectivity. Now, when everyone is on, if everyone is using broadband, so the bandwidth will be, you know, it will not be very powerful. You need high-speed broadband to transmit information. So I think that's also a challenge, yeah, because everyone is at home, you know, using their mobile phones, using their laptops, getting the latest news, doing things at home. So that is also a challenge for us. It's also connectivity, yeah. Okay, I think those are just some of the things that we face as journalists, but one thing for sure, we have become smarter, number one. Number two, we know how to use technology, but most importantly, I think it's the information, yeah? Now, should there be another a pandemic, touch wood, yeah, we will now be prepared. We know that what will happen next, okay, should there be any new pandemic, you will know that, okay, we need to assemble a group of panel of experts so that all the journalists can get the information. People will be well informed. That's the most important thing. And they, the experts, know how to tell a good story. They will know how to make complex ideas simple. We need to train them. And journalists also need to constantly update their information. So those are some of the challenges that we face. But I think we become smarter and better because of all this. We learn a lot. But I think there's also room for improvement. Thank you so much.
Health law. So health law is the field of law that encompasses federal, state, and local law, rules, regulations, and other jurisprudence among providers, payers, and vendors to the healthcare industry and its patients, and delivery of healthcare services with an emphasis on operations, regulatory, and transactional issues. So what is public health law? So public health law examines the authority of the government at various jurisdictional levels to improve the health of the general populations within societal limits and norms. Public health law focuses on the duties of the government to achieve these goals, limits on that power, and the population perspective. Public health law is also focuses on the legal issues in public health practice and on the public health effects on legal practice. So, role of media on public health. It is well recognized that the media plays an enormously influential role in public responses to health issues. The mass media, print, television, radio, and internet has an unparalleled reach as a communication mechanism. It has substantial power in setting agendas, that is, what we should concern about, take action on, and framing issues. That is how we should think about them. So public health professionals have always been sensitive to the perceived power of the mass media. In fact, public health has often had the challenging task of both using the media to influence health practices while countering this some influencer while it encourage. So why media is sensitive to the health professionals? It is very important because the health professionals are always sensitive to the sensitive to health professionals because the media are part of the macro factors which influence health behavior and policy, and so critical public health researchers with an interest in media need to ask some key questions, such as who is setting the agendas, in whose interest does it serve, and indeed who are the media. So that is the common questions from the health professionals. So how mass media works on public health? Mass media work perhaps most productively where the focus is on lifestyle health promotion, but has a less clear role for public health issues stemming from social and material conditions. So campaigns where members of public are encouraged to compel their health care. So it has been well established that the media play a crucial role in framing public health debates and shaping public perceptions by selecting which issues are reported and how they are represented. So we know that in public health debates, the media contribute to the framing of health problems, their drivers and potential solutions with stakeholders variously positioned across those debates. So what media can do for the public health issues? In this respect, media production needs to be considered its broadcast, its broadest terms, not simply as discourse manufactured in newsroom, television, studios, and other media institutions, but as the outcome of a specific network, occupational practices, technologies, and structural context with embedded ideological assumptions. So are we ready for the public health preparedness? So you all know, because we are now passing a pandemic period with the novel coronavirus. So there are lots of pandemic happened before this year. The novel influenza, emerging infectious disease, natural disaster have promoted a re-examination of the nation's public health system. So it affects the public health system. The jetliner and anthrax attacks of 2001, the SARS outbreak of 2003, Hurricane Rita, Katrina 2005, 2009, the H1N1 influenza pandemic, Hurricane Irene 2011. So there are lots of pandemic happens and disaster happens during last few years back. So the outpouring of resources and attention of the biosecurity has supported a public health law renaissance. So government responsibilities for this public health, we can say success or failure. So perceived government failure in responses to public health emergencies continue to stoke public anxiety, adding politic pressure for more effective preparedness planning. So all hazards and resilience have become watchwords in preparedness. So two vertical strategies targeting specific threats like in the public health. So development of pathogen or toxin specific vaccines and treatment remain a priority. But horizontal strategies, investment in public health infrastructure are needed to ensure preparedness for a broad range of emergencies while also enhancing capabilities to meet routine needs. So approach of modern public health issues. So modern public health emergencies preparedness strategies continue to draw on ancient public health law interventions such as isolation and quarantine. So while also adopting updated approaches to social distancing, development and rapid development of medical countermeasures and allocation of scarce resources under exigent circumstances, policies must be delicately balanced, protecting individual rights with meeting collective needs, promoting cooperations and coordination across jurisdiction, and ensuring fairness in meeting the needs of particularly vulnerable populations. So public health emergencies preparedness addresses hazards and vulnerabilities whose scale, rapid onset, or unpredictably threatens to overwhelm routine capabilities. So now we are passing over the the pandemic situations with the COVID-19. So I think we should be more careful about this public health awareness and media reporting. So what Mr. Swami told that we should not report in a fake news, and also we should be very careful about the reporting on public health in a media. So thank you all. So I'm passing this microphone to Mr. Siva Kumar.
Thank you, Dr. Zahid. We'll come back to you. You spoke about infrastructure required, the implementation of public health law in countries, and I have one question regarding that, but I'll come back to that later. Basically, I think in many countries, public health law is already inbuilt into the existing health laws and health related laws, but I will come for clarification later. At the moment, we have the next panelist, which is we have Ms. Khairulunisa Abdul Qadir. She is the health education officer with the National Health Institute Malaysia, and she'll tell us about matters connected with public health education and awareness. Over to Ms. Qadir.
Mike?
Yes, you have to unmute yourself. Yeah. Yeah, please continue. Please
Lisa,
welcome.
can you please share the PowerPoint slide? Okay,
Yes.
my topics today is on communicating new norms. When we are talking about, it never happened before in Malaysia or in all over the world. Last pandemic happened 100 years ago, Spanish flu. So it's very new, not only to the health community, but also to the Malaysian society and to other people in other country. So what I can share here today is that in Ministry of Health, we do have this one division where the task of our division is to help promotion and education. Where in this division, we do communicate with the public, with the media. We have the planning, development, implementation, and evaluation have health promotion and education programs. If maybe some of you ever heard about a healthy lifestyle campaign, no smoking campaign. So we manage health campaigns, such as, like I said before, healthy lifestyle campaigns. And we do manage health education programs through mass media, but in normal situation, in non-pandemic time. We develop training programs, we do consultation in terms of health education. And health promotion during pandemic. Health promotion matters during the COVID-19 pandemic. When it first come to Malaysia, we heard the managing of the pandemic situation, which in Ministry of Health we call this this department, this body is Centered for Crisis Preparedness, where in this CPRC, the short terms of Crisis Preparedness Center, all the managing of information, all the cases, all the information must go through the CPRC. And from there, all the experts will come and have a discussion, and even in terms of promotion or how we can manage to communicate the message to the public. So in CPRC, we are discussing and we are giving the information through one centralized this CPRC, we call it. And now, how we communicate the new norms to prevent infection? How how we can suggest how to communicate the new norms to the public, such as hand washing, social distancing, wearing face masks.
Hello.
Those are all the manifestation of human behavior, and it's very difficult to change human behavior. We can give information, but are we sure that the people, the rakyat, the Malaysian will change the behavior? So the experts in terms of health promotion, doctors, health promotion officer, all the medical officer, we are trying to use taking to the approach, for example, protective health motivation theory, health belief model, where how we know that we sure that people will only act on the health warning if they think that they believe that they are personally susceptible to develop the conditions, and they perceive that the condition as severe, and believe that they are capable to perform the preventive action. So every messages that we tailor to the public, we have to take into consideration how the public will take the message and act upon the message. So like I said before, we do have health campaigns, but in pandemic time, we have to do the unusual thing. We have to really collaborate with all the government agency. Like now is under National Security Center to communicate about the pandemic. So communicating the new norms, disseminating the accurate, appropriate, and relevant information in a timely, equitable, and innovative manner, and how the communication get across the Malaysian public. What types of messages? So how can we know that we are giving the right kind of messages to the public? Okay, so in Ministry of Health, not only that, we also do a few survey or few research in order to know what are the public is feeling about this pandemic and what should we communicate better. Like we have a few research during the pandemic time. For example, we are doing the research on Malaysia health behavior during the movement control order following the COVID, and we found that during the MCO, most of the Malaysian public, they eat a lot. They cook and they eat a lot during the pandemic. So what kind of messages that is post-pandemic? So that we wanted to make sure that not only they not contracted with the pandemic, the COVID, but also they will not get the non-communicable diseases due to the pandemic lockdown. So that kind of messages that we're bringing. And we even did a social media sentiment analysis during the COVID-19, where from the social media analysis, we found out that the public wish that the Ministry of Health can come with more infographic, like Mr. Sulaiman told just now. We come up with more infographic, the number of the cases, where the cases come from, where the origin of the number of cases. So after the sentiment analysis, we did a daily sentiment analysis in order to make sure that what more that the public wanted to know, to have a security in their mind. So we did a sentiment analysis, and we did a KAP study among Malaysia who travel frequently to Singapore, and we did a social responsibility study. From this study, we come up with messages. For example, Next, for example, from the sentiment analysis, we found out a few themes that emerging from the sentiment analysis from what are the public concerned with, like they are concerned about their mental health issues, they are concerned about their kids' education, they are concerned about the job, the all the government benefits, and a few themes come out. So this theme that come up from the sentiment analysis, we are using it to make a messages that we disseminate to the public. For example, on the in terms of mental health issue, a few weeks after the movement control order, we have this from MKN, we have this like call center for if you have like problem, you are stressful, you can call the Majlis Keselamatan Nasional, you can call the Ministry of Health in order to get info, in order to get advice, in order to get on call, telephone counseling. So we did all of these telemed messages based on what we get from the public itself, and we tailor it so that the public can bring the message back to their home and they can act upon it. But who's in the middle of our chain of communication? How can it get across the public? So we are using the communication, organization, and training. But in this case, we are utilizing mass media, for example, social marketing, public relation with the news. We are collaborating with the news. So that is why every 5 p.m. in the evening, our DG will have his press release so that he himself, big figures in Ministry of Health, convincing the public on the pandemic issues. So we are collaborating. You guys, the media people, the media owner, the influencer are our middle agent to communicate our messages that we get from the secondary, the primary data, so that you can tailor the message according to the public, how can the public understand. So you are the media people are very, very important in this pandemic crisis. Without the media, we cannot convey. Yeah, it's true. We have our own social media. We have our own all the social media, Ministry of Health social media. We have like 1 million plus followers. But we do need we still need the media agencies to collaborate with us. And as a health ministry staff, I think the collaboration between the media and the ministry, not only Ministry of Health and other ministry under MKN, is are very, very good, I think. And we also do the collaboration with other agency in order to make sure that these messages reach the public. And from the training part, especially the post-COVID, where we find that the mental health problem is emerging, so we do the training part so that we can cover the post-COVID issues. And okay, we disseminate the information. We know that the public are getting our information, but how we get the feedback from the public? Is it our information is enough or not? So the feedback we get is also from you guys, from the media people, from the influencer, from the television, from the radio. So we get information from the media people whether our messages is okay or not, or whether the public is can fine-tune with our messages, can they understand our messages. So from our analysis, we found out that most of Malaysian public have a very positive sentiments toward these health behavioral messages, the new norms like wearing of masks, using of hand sanitizer, social distancing, not organizing any functions. And also from the media, we get to know that people are opting towards online buying. So from feedback, we get it from you guys, the media people. I think that's all from my sharing of experience.
Invitation. Now I would like to give a brief speech and sharing about world hair story industry trends, economy recovery, and media broadcasters innovation. A growing number of high net worth individuals are thinking hair stories about in the past 2 or 3 decades for physical, mental, spiritual, emotional, environmental, and social purposes. For hair stories subsectors, according to the WHO report that from now to 2025, the global countries are facing population getting older and older. This is a huge challenges for global countries. And world hair stories economy has keep growing fastly. You can see this global hair tourist market is 3.2 trillion US dollars, and will keep annually about 6 to 9% annual growth. Up to now, Asia Pacific region is the world's #1 active market in global cross-border hair stories market. We know hair stories industry is an ecosystem that including medical tourists, wellness tourists, dental tourists, spa tourists, sports tourists, accessible tourism, senior hair tourists, halal hair tourists, and in China we also have the traditional Chinese medicine hair stories. So it includes more than 10 subsectors, and has been one of the fastest growth sectors according to the UNWTO report, and made a great contribution to the world economic growth. According to UNWTO report, China has been the fastest growing outbound tourist market since 2012, and China is the top #1 international tourist spender in the world. And UNWTO reported that world's top tourist spender, the #1 is China, surpassed the USA, Germany, UK, France, Australia, Russia, Canada, Korea, and Italy. So this is why up to now, more than 130 countries has jumped into China market for cross-border hair tourist industry business. Here I would like to share the Belt and Road Initiative that most of the ASEAN countries has joined the Belt and Road Initiative. Up to now, 138 countries joined the Belt and Road Initiative, and more than 2,000 cooperation projects have been invested and carried out. 1,500 international free trade zones has joined the Belt and Road and has created thousands of millions of jobs worldwide for all of the countries and regions which has joined the Belt and Road. This is Belt and Road Initiative Forum organized by China government in Beijing in 2017. All of the president, prime minister, and international organizations, delegates participated. Last week, China government organized a high-level conference on Belt and Road International Cooperation 2020. All of the Africa countries, presidents and prime minister, and also the deputy secretary general from the UNCTAD and Secretary General from WHO has also participated for the collaboration in anti-COVID-19 and public health, especially in the vaccine and medicine research and development, humanitarian relief in healthcare collaboration with China and Africa countries and Belt and Road countries. For the China-Africa Summit on Solidarity Against the COVID-19, this is a conference, Zoom is an online conference, and it's an extraordinarily China-Africa Summit focused on the collaboration, cooperation, and innovation on against COVID-19, supported by the United Nations and the WHO. So for global health story sustainable development, we have carried out innovative solutions through the public-private partnership policies. We call it the PPP policies. We just give a brief introduction of several health stories clusters in China and worldwide. This is Shanghai International Medical Center with huge investment, and the health story city clusters in different countries and regions with huge financial investment. You can see all of these are huge health stories city clusters. For Belt and Road health story development, we are very active to collaborate with free trade zones to pioneer global sustainable development. So we have set up World Healthcare Investment and Trade Platform in 3 sectors. Belt and Road Initiative covering up to now 138 countries and regions. Free trade zones covering 1,050 free trade zones worldwide, and the PPP project covering 2,000 cooperation projects. All of these projects are matched very well with United Nations SDG goals. Number 3, SDG number 3 goes good health and well-being. Number 4, quality education. Number 11, sustainable cities. And 17, partnership for the goals. So all of these SDG goals are initiated and supported by United Nations. So all of our Belt and Road Initiative and PPP programs and free trade zones are highly follow the guideline from United Nations. And for health stories, please look at this map. So health stories is play a vital role for global economy recovery and match very well for all of the SDG goals from number 1 to the number 17. So has a highly matched collaboration and co-benefits with all of the subsectors of SDG goals. So for the global health story, economy recovery, and ecosystem sustainable development, why the news media should focus on healthcare and health stories? So we think media broadcasters play a vital, important role and should set up innovation systems in post-COVID-19 areas to help the governments to mitigate the COVID-19 impact on the economy, on the public healthcare system. So the news media and broadcasters can help to in the health cities, brand promotion, health destination, brand promotion and marketing, foreign direct investment attraction, economy recovery, healthy lifestyle initiative, education, confidence building of the health destinations, job creations. So news media are very play important roles, are very vital for the countries, destinations, and authorities. We are providing World Health Story strategy consulting for at B2G and B2B levels. B2G level business to government and G2G government to government strategic consulting. We help set up the health stories transformation and green recovery after the pandemic. Now we have launched the digital marketing media campaigns and welcome collaboration for global leading broadcasters, including the UNSDG Healthy Cities, interview, report, brand marketing, and health destinations, TV and digital marketing campaigns. We welcome the global broadcaster to collaborate. We can help them to do marketing, branding in global market, especially in Asia and the China market, to attract investment from the targeted market. We also launched the Health Destination 500 roadshow in China to help the international Ministry of Tourism and tourist authorities to keep market access, keep business, and keep connected with Chinese buyers and Chinese business partners. And also we is the organizer and host of WMTCE, which is China's largest industry exhibition, World Health and Medical Tourism Conference exhibition in the industries, and organized in Shanghai, Beijing, Guangzhou, Hainan, Chengdu each year. This is the largest industry exhibition focused in cross-border healthcare, health tourism industries. This is all of the global top health tourism providers and brandings, including all of the stakeholders in the health tourism industry ecosystem, has participated as exhibitors, sponsors, and partners to. So we have collaborated with healthcare industry partners and tourism industry media partners. So we hope we can set up the innovative collaboration to pioneer global healthcare through leadership and innovation, because leadership innovation is a new normal in the COVID pandemic new areas. And for more information, you can keep follow up by our website and social medias. Thank you for your listening, and we hopefully the news medias and broadcasters can take innovative measures to help the countries, destinations, authorities mitigate impact after this.
Thank you, Dr. Fang. We will come back to with questions regarding how China is promoting
policymakers to address them. So if I use my home country, for example, I'm from the UK, there has been a disproportionate impact of the novel coronavirus on people of Black and ethnic minorities, and also migrant workers, who are a really key component of the British national healthcare system. And workers, healthcare workers from overseas, so if we look at Filipino healthcare workers, for example, they're often in positions that have placed them in close contact with patients, and that elevates their risk. And thus they're disproportionately impacted by the novel coronavirus. By telling the story of these people, by putting a face to a name, we help make it easier for people to understand where inequity exists, why we need a whole of society approach to health, and to really see improvements in health for everybody. And again, I just want to stress the importance of that information being accurate and timely and continually moving. To finish, I would like to say that as health experts, we know that we have an important role to play in how we communicate with journalists, with policymakers, and with the people. And as Mr. Suleiman said, we need to evolve, not just to present our material in peer-reviewed journals or in highbrow newspapers, but in a whole range of different medias. But as I know from personal experience, having partners on that journey, particularly in this instance from the media side, is really key to successfully communicating accurate, timely health information and to getting people to understand, debate, discuss, and really see improvements in their health. Thank you very much for giving me the time to speak today.